For as little as $1 per month, you can support independent journalism by supporting Mieum Media on Patreon. That's mere pocket change to support quality local content creation. To subscribe, visit patreon.com/MIEUM Media. Thank you to all paid subscribers for helping to grow Mieum Media and for supporting independent journalism.
According to this nationwide survey, more doctors smoke Camels than any other cigarette. Try Camels yourself, the cigarette so many doctors enjoy.
The fact that commercials like this were uncontroversial when they aired, but are considered downright absurd today, underscores how the decline of cigarette use in the United States is a true public health victory. Last year, the Centers for Disease Control announced that smoking rates had hit historic lows. But even so, health advocates argue that more can be done to reduce these numbers even further. And in Connecticut's current legislative session, a bipartisan proposal would increase the purchasing age from tobacco from 18 to 21. Bridgeport, Hartford, Milford, South Windsor, Southington, Trumbull, and Wallingford have all passed similar measures. But should the law be changed statewide?
We know that 95% of people that start smoking before they're 21. We can erase our death rate by about 10% if we can get this age raised. So that's my main thing is, as a cancer survivor, I'll do anything I can to keep other people from hearing those words, you have cancer.
As the law stands now, 18-year-olds are legally allowed to purchase tobacco products. That makes it easy for 18-year-old high school students, typically seniors, to purchase products for minors who attend the same school. Raising the age would hope to put a stop to that. But however good the intentions are, will these changes be effective? For example, the age to purchase alcohol is 21, yet many high school students still manage to gain access to it.
If we're serious about banning sales to people under 21, the lifeline that younger kids have from 18-year-olds will likely get cut off or substantially decreased. And I think that will result in decreased youth use.
Others raised concerns about how local businesses, such as convenience stores, would be affected by a lower demand for tobacco products. I asked about this to State Senator Saad Anwar, who implemented a tobacco age increase in South Windsor when he was mayor.
I think this would importantly would save lives and would reduce the cost of healthcare, because the impact of tobacco on the cigarettes has been so much on the young people and older people that we will be saving a lot of money if this happens. Now, individual businesses who are actually using all of their effort to sell tobacco, they will lose a little bit of business, but this is not how you make money, by hurting other people. So I hope they would actually look at other options for their businesses.
I spoke to many people who supported the thrust of the bill, but who felt that raising the age infringes on the autonomy of legal adults. If someone can vote, own property, or join the army, then why should they be unable to purchase tobacco? State Senator Heather Summers is a Republican supporting the age increase. I asked State Senator Summers how she squares her support for the increased tobacco age with her views on overregulation and big government.
For me, being one of the chairs and leadership of public health, this is a public health crisis. We see the results. We will have close to 56,000 people die of issues related to smoking in the state of Connecticut this year, especially if they start as a teenager. It contributes to being the #1 killer in the United States and in Connecticut, which is heart disease. And I think we have a duty as government to set regulations such that people can make informed decisions.
Everyone I spoke with emphasized the importance of making sure kids don't get hooked on nicotine products. According to Dr. Andrew Salner of Hartford Hospital, people under the age of 21 have a higher chance of becoming addicted.
What the research shows is that young people, probably under 21, have a higher likelihood of not being able to make a truly informed decision about using nicotine, but also have a higher risk of becoming addicted to nicotine.
Although the overall number of smokers is declining, there are worrying trends concerning the use of e-cigarettes among young people. Leah, a 6th grader, told Mieum Media she frequently sees people on social media using e-cigarettes.
People on Snapchat will put on their stories them doing it and how it looks cool, and then also on Twitter or maybe Instagram, so it makes them look like they're cool.
We reached out to a number of organizations who either oppose raising the age or who stand to lose money if the age is raised. The Smoke-Free Alternatives Trade Association, or SFATA, is one such group. They represent businesses who sell vapor products such as e-cigarettes. I sat down with Andrew Albright, the president of Connecticut's SFATA chapter, and asked him why he opposes raising the age.
Well, we're always against raising the age of vapor products because that creates a barrier of entry, and unfortunately 80+% of smokers start before the age of 18, which would be the legal age. So we have an issue where enforcement is really our problem, and the state and federal government doesn't seem to see it that way. They seem to think that by raising the age that it will deter teens from vaping and smoking, which obviously isn't the issue because there's already an age in place that's not being enforced.
Although vapor products do not contain tobacco, they are legally classified as tobacco products. They're generally considered safer than standard combustible cigarettes, but since they have nicotine, they can still be addictive. Vapor products, especially Juul, are increasingly popular with young people, but Andrew maintained that minors' misuse of an adult product should not detract from its intended purpose of helping users to quit smoking, and that SFATA believes Juul has given the industry a bad reputation.
Our game plan was always to get enough nicotine for that smoker to stop smoking, and then wean their way down off of nicotine and maybe get off of nicotine altogether. And in fact, every liquid you see in any of our shops, you can get in 0 milligram. So you can get down to 0 nicotine, and there is a step down process. Juul came in with 50 milligrams, which is double what we were using as the highest milligram before, and gave no step down process. It's 50 milligrams or no vaping whatsoever in a Juul.
In short, Andrew and SFATA argue that when used correctly, vapor products can help people quit smoking. Thus far, the evidence seems to bear this out. Therefore, SFATA opposes raising the age to 21, as it would deprive legal adults access to a product that could help them to quit smoking. But at the same time, proponents of raising the age point to the widespread and increasing vapor product use amongst minors. They fear that the widespread proliferation of vaping products could make the problem worse. Although the declining number of smokers is promising, few deny that there's more work to be done. Vapor products seem to have promise as aids to help people quit smoking, but the widespread use by minors cannot be ignored.
I think people are recognizing that it's a more serious problem. I mean, you have the problems with alcohol, with cirrhosis if you drink long enough, but cigarettes almost always take a life in the end. I mean, it really is an epidemic.